Okay, the number. Oh god, 6, 12, 18. Number 21 most viewed PragerU video. What's wrong with government healthcare? I could think of a few answers to the question, what's wrong with government healthcare? I could think of a few things PragerU might say, and think of a few responses already. But let's just dive in and see what we've got. What you got?
It's very easy for a politician to stand up before voters and say healthcare is a right, and then passionately advocate for single payer, free healthcare, or Medicare for all, whatever term they might use.
Goddamn right. Based as fuck. Based and red pill. This guy, he knows what's up. This is great. I love it.
But before we consider the merits of the government managing your healthcare, and that's what this all boils down to, maybe we should ask a more basic question. What do we mean by healthcare?
This is a weird angle I didn't expect, but let's hear him out. That's what it boils down to, government controlling your healthcare. I don't care about the government controlling my healthcare. I just want the government to fucking pay for it. That's what I want. All right, hold up. Let's hear him out, yeah? Hoover Institute at Stanford. Oh, God. I haven't heard Hoover Institute in a while.
Because if you get sick, and here we're talking major illness or you're in serious pain, you don't just want healthcare. You want quality healthcare.
I don't know why you'd make a distinction like that. Okay.
Where's your best chance of finding that? The answer is right here in America. For skilled doctors, cutting-edge medical treatments, and care without long delays, no other country rivals the United States. Not even close.
You know why that is, right? That's because tens of millions of people in the United States just flat out don't get any health care. Let's do a little turnaround like you did at the start. It's very easy for some asshole from the Hoover Institute to come on the internet and say, oh, government health care, bad, woo. But you know, when you're bringing up skilled doctors, cutting edge medical treatment, and timely care, you're leaving out the fact that for a large chunk of this country, this is not available to them. This is not a thing people get. People go years, oh, I got some weird lump on my side, but I don't have health insurance. It's gonna fucking cost me thousands of dollars to get this checked out. And what do you know? Turns out to be fucking cancer. Congratulations, you have 3 months to live. And then this guy will come out and say, oh yeah, the United States totally has the best doctors and the best skilled healthcare and timely care. If you just ignore, you know, all the diabetic peasants fucking dying in the streets, then yeah, we are the best. All right, okay.
Nobody from Texas is going to Canada for medical treatment.
Oh yeah? Well, guess what, asshole? Senator Rand Paul joins rising number of Americans going abroad for healthcare. Kentucky Senator Rand Paul has opted to go to Canada for hernia surgery. Earlier this month, longtime critic of socialized medicine, Senator Rand Paul of Kentucky, created cry to stir when news outlets reported he was planning on undergoing hernia surgery in Canada. Wow! I really wonder, like, are these people aware of the absurdity of what they say? Or are they just like, oh yeah, I'm gonna tell you all bald-faced fucking lies so we don't have to pay taxes? Because honestly, poor people are kind of gross, and like, I really wouldn't like have an objection to like just 20 million poor people dying if I never have to see a homeless person on the street again. I think that's what this boils down to. Let's be honest, that's what this boils down to. Let's go.
It's almost always the other way around.
No, it's fucking not. They don't. Some rich people who can afford it fucking come here. But guess what? Poor people, they're not gonna fucking come to the United States for healthcare. They stay in fucking Canada.
Sure, our healthcare system has lots of issues, and we should address them. But do we really want to
Okay, is he going to address them in this video? That's rhetorical. You know he's not. You know he ain't.
upend all the
These people never actually address them. They just say, yeah, maybe if I shrug my shoulders and I say, let the free market take care of it, maybe things will magically get better. That's why border towns are riddled with dentists, doctors, pharmacies in Mexico. Yeah, like holy shit, the other side of, like, The Mexican side of Nogales is like, okay, I had issue with treatment a while back, and one of my doctors was like, have you considered going to Nogales? I know another doctor in Nogales who will get you the same stuff for cheaper. I found another option, but it was like, I considered it. It's only a couple 100 miles.
But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would have to happen if we completely turn healthcare over to the government.
What advantages do we really have? Because the advantages that you've described so far are only advantages for like the top upper echelons of our society. And the rest of us don't see it. The rest of us don't get any of the benefits. Any of the pros that you say, it's just out of reach for the rest of us. So why not destroy the system and tear it all upside down? Even if I was agreeing with your premise that having a new system like single payer or Medicare for all would destroy everything we've made, I don't agree it would, but even if I did, why not? Like, most of us don't have much money to afford these things. Fuck yeah, let's do it. Because even then, that would still be an abject improvement for us. Of course, I'm gonna support that. I know you're at the Hoover Institute, you're making a lot of money, you probably are so out of touch and insulated from the rest of us that you don't realize it, but hey, I'm just explaining it to you, because clearly that Hoover Institute ain't teaching you shit.
So let's imagine we make the change.
Okay.
We hear a lot about how great free healthcare would be.
Yes.
But it's only fair we look at the downside. The first is that government-run
Downside. Okay. I haven't heard no devil's advocate arguments, but all right.
But it's only fair we look at the downside.
Okay, let's go.
The first is that government-run healthcare takes medical decisions away from patients. That means you.
I hope he explains this.
And puts them in the hands of bureaucrats. They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery, or a bypass, or even...
But they do this already.
...whether you qualify for cancer treatment.
Okay, but your insurance company does that right now, already. And so does the government, actually. The government sets rules for, like, when you can do these things. Now, it's still up to the judgment of the doctors. It's not like, oh yeah, you know, this guy here has been in a car accident, so I'm going to give him chemotherapy to treat that. You don't treat chemotherapy doesn't treat, you know, physical trauma. There are rules that you have to follow. The government does set rules for these things already.
For example, how many MRI machines are going to be available?
How many MRI machines are going to be available? It doesn't elaborate on that. What is this supposed to mean? Am I missing something? Or is he saying it's better to let the free market handle how many MRI machines you get at a hospital? I imagine with the government-run healthcare, we probably would have more MRI machines because MRI machines are like big and expensive and they take up a lot of space. I've had an MRI before. You got to go into like this specially built room that's like lead lined because the MRI, magnetic resonance imaging, you can't have any metal on you. And like the special room is built so that nothing outside is going to get sucked into it. Hey, look. Government rules set that up too. It's not an easy thing to build. So I imagine if there's government funding for this, hospitals will probably have more. Or is there a limited number of MRI machines in existence that we can only have like 1,000 existing at one time?
Or under what conditions you can get back surgery or a bypass?
I've heard this part a lot, a bypass. A lot of insurance companies right now will say, we're not going to approve this treatment because you don't qualify for it. There are a lot of people who are considered obese, like morbidly obese, like really bad. A bypass would objectively help them. But insurance companies don't want to fucking pay for that. Insurance companies literally hire people just to look for reasons to say no. Insurance companies have employees who literally go through all of these insurance claims and say, I'm rejecting you. They look for some tiny reason just to say no. Welcome to America. There are a lot of people who would like benefit from bypass surgery, and I say like probably should be doing more than we have. In the United States, it's probably a lot of people who need it. who aren't getting it. Insurance companies want to add all these other qualifications to it. I'm not sure how it goes. You gotta go through a diet. You have to be this weight for this long, and it's like, man, this person's fucking suffering. Give them the treatment. So here's a question. You want a big, scary government bureaucrat in a suit making the decision? Or you want an insurance company who only cares about money? Personally, I'd take the government if I had to pick between the two. I'm just saying.
Or even whether you qualify for cancer treatment.
Yeah, they do that with all cancer treatment already. There are a lot of cancer treatments. Insurance companies are like, yeah, we're not going to fund that. You got to try these other cancer treatments first. These other cancer treatments are cheaper. We're not going to fund your chemotherapy. You got to try these other stuff first.
That's how it works in the United Kingdom under its single-payer system.
Okay, yeah, all right.
Because it has finite resources, the National Health Service, or NHS, sharply restricts access to treatments like hip and knee replacements,
there we go,
cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes.
They do this for everything here. There's a thing some people have described when conservatives talk about, they try to criticize socialism or communism, and they just describe capitalism. This is like a similar thing to that. He's trying to criticize the NHS, and now he's just describing capitalism. He's just describing what happens here in the United States.
If you suffer from any of these ailments, and many others in the UK, you may just have to live with the pain. And let's hope you don't have a medical emergency.
Christ almighty, dude. How out of touch do you have to fucking be?
In a January 2018 article in the New York Times, patients in emergency rooms around London are described as having to wait 12 hours before they are tended to. Corridors are jammed with beds carrying the frail and elderly. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month.
Wow, they elected a Tory government who said they were gonna cut funding for these things, and then they did, and now things are bad? Wow, who could have seen this coming? Wow, Boris Johnson is kind of a shit fucking leader? Brexit hurt Great Britain? I guess this is just a strategy conservatives do. Conservatives are like, you know why government programs helping you? Government programs suck. And then the moment they get in power, they do everything they can with that power to sabotage those government systems, so then they can say, well, look, these government systems suck. And it's like, no, dog, you're the reason it sucks. You fucked it. You stabbed it. You cut its Achilles heel. You cut the tendon. You're the reason it's bad. It was good before you came along. It will be better when you leave. All right.
That hardly seems like an improvement over what we have in the US.
Oh, fuck you, you shit turd. These people fucking want us all dead. Wow, guys, this underfunded thing is not performing well. Because it's performing poorly, let's fund it less. There we go.
A second big problem with single-payer systems is that they are expensive. Really expensive.
But less expensive than all of our healthcare and insurance combined. Instead of having a whole bunch of individual things, turns out when you have one singular pool, it's a lot cheaper.
A recent study by the Mercatus Center at George Mason University found that a Bernie Sanders-style Medicare for all health system would cost a tidy $32.6 trillion over 10 years.
And how much are we paying right now?
That's on top of what the federal government spends on healthcare today.
Oh, he's not gonna do it.
This is not a new number. Other studies have found the cost to be roughly in the same range. So, how would we pay for it?
Okay, he's just gonna gloss over that.
Studies have found that
he's not even gonna mention it. Oh, shit. Hold on, what's the one he cited? Wasn't this? Oh, Bernie.
Of all people, for sponsoring a study that shows that Medicare for all would save the American people $2 trillion over a 10-year period. I suspect that is not what the Koch brothers intended to do, but that is what is in the study of the Mercatus Center, an organization that is significantly funded by the Koch brothers. At a time when the United States spends...
I didn't realize they were funded by the Koch brothers. Man, what a fucking sellout. So, okay, as I remember correctly, this study showed that, yeah, this study's like a single payer plan like Medicare for all will cost $32.6 trillion over 10 years. When you look at the totality of all the expenses we make for healthcare, this plan is $2 trillion cheaper over the next 10 years. So let's move on.
What the federal government spends on healthcare today. And this is not a new number. Other studies have found the cost to be roughly in the same range.
Good. No, good. Fine. What argument do you think you're making here? Just throwing out a big number like this? It's not a convincing argument. You need to give a reason for why this is bad. You say, oh, that's a lot of money. That's a lot of government spending. It's an improvement.
So, how would we pay for it?
And here we go.
Kenneth Thorpe, a professor at Emory University
All
and
right.
health policy
Yeah, sure.
official in the Clinton administration, spells it out. If you are going to go in this direction, Medicare for all, the tax increases are going to be enormous. Not just for the rich, Thorpe estimates, but for working Americans and the poor too. Charles Blahous, the author of the Mercatus study, puts it this way. Even a doubling.
Yeah, okay. Paid for by the Koch brothers, which is not something this guy's gonna tell you.
Of all projected individual and corporate income taxes would be insufficient to finance these added federal costs.
I don't think that's true.
And he considers that a conservative estimate.
And you know something else these people aren't going to tell you? What happens when someone who's like indigent, when someone who can't pay for healthcare gets into an accident or something, gets into the hospital, they had a heart attack, oh, they were in a car accident, their limb got ripped off, okay. They take them to the hospital, they're going to get treated because, you know, we're not complete monsters. And then, they don't have a way to pay for it after that. They didn't have insurance. They don't have a job. What's gonna happen? Who's gonna pay for it? Oh, that's right. We already have a program that pays for these things. In the end, Uncle Sam still pays for those people. It's still fucking covered. The numbers don't fucking mean anything. I don't know. Y'all never seem to mention it, that in the end, our tax dollars are still kind of paying for it. It would be an improvement just to put everybody into the same pool. One more thing to add on here. 32.6 trillion over 10 years. Tax increases are going to be enormous. Here's a fun thing for all of you. Did you know that Medicare and Medicaid, as a proportion of the money that they get, they turn out to be more efficient than private health insurance does? Private health insurance companies have all these administrative costs that go into them. Medicare and Medicaid, two of our social welfare programs that cover people who aren't working and are like poor and disabled, have a larger share of people who are expected to be a larger financial drain. These two systems work better than private insurance, which private insurance is mostly owned by people who are working and get it through their place of employment. And they're less efficient than Medicare and Medicaid. But this guy's not going to tell you about that because he's funded by oil money.
Costs.
Yeah,
and he considers that a conservative estimate. Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget in 2010.
Good.
By 2030, that number is projected to be 80%. In other
I have some doubts.
words, in a few years, Ontario will have little money to pay for anything except healthcare.
I don't buy it. Source. Trust me, bro. Let me see if there's like facts and sources. Well, this part doesn't say the same thing. Should the U.S. adopt Medicare for all? Ontario's single-payer healthcare takes up 43% of its budget and has grown at an unsustainable rate. Canada already experiences the cost of Medicare for all. In Ontario, the country's biggest province, healthcare costs took up over 40% of its entire budget in 2017. The rate of growth of healthcare expenses in Canadian provinces since 2001 has been unsustainable. Nothing about 2030. Yeah, this doesn't really say much. It's just that in 15 years, between 2001 to 2016, healthcare spending grew by 116.4%. That's not the same argument, though. It grew by 106%, but the rest grew by 94.6%. It's not that bad. In the last 15 years, 2001 2016, saw provincial governments increase healthcare spending at an unsustainable pace. Indeed, during this period, healthcare spending grew 116.4%, outpacing growth in other program spending 94.6%, and GDP 77.4%. Wow, so only 20% more in healthcare compared to other program spending? That sounds like reasonable. That sounds like what I'd expect. The share of program spending represented by healthcare in total grew from 37% to 40%. Oh, wow. See, when you put it like that, that's like nothing. Holy crap. Well, you know, if any of you want to read that, it's out there. But let's carry on. What else you got?
And perhaps most importantly, government-run systems depress the search for new cures.
This is going to be bullshit.
Biomedical research spending in the U.S. far outpaces that of any country with nationalized health care.
Biomedical research spending far outpaces that of any country with nationalized healthcare.
Even when you account for differences in population or size of economies.
What is this argument? No, wait, this is really stupid. Holy shit, this is really stupid. Biomedical research spending is not the same thing as nationalized healthcare. Nationalized healthcare is not the same as medical research. You know where this money comes from, right? A lot of it comes from the government.
That's one reason medical breakthroughs rarely come from countries where the government controls healthcare.
He didn't even compare private research and development with government R&D, lol. He compared countries instead. Yeah. Ah, here we are. This is perfect. Okay, sciencemag.org. This is what I was looking for. Posted in 2017. Data check. U.S. government share of research funding falls below 50%. For the first time in the post-World War II era, the federal government no longer funds a majority of the basic research carried out in the United States. Yeah, that edge that we had over the whole world, bye-bye, is gone. Data from ongoing surveys by the National Science Foundation show that federal agencies provided only 44% of the $86 billion spent on basic research in 2015. That face when someone compares two different healthcare plans by comparing different methods not in healthcare planning but in research, and didn't even compare methods but compared countries instead. Yeah, these people have to really reach to make some of these arguments. Like I said, I wonder if some of them are aware of how absurd they are. I feel like they are, and they're just lying to us because they want us all to die.
That's one reason medical breakthroughs rarely come from countries where the government controls healthcare. They come from the United States, where the government doesn't.
Comparing two entirely different things.
The lion's share of biomedical research and development spending in the U.S., over $70 billion in 2012, comes from the private sector.
Ah! This video came out 2018, just a year after that article. Curious. It's like he was sitting on it for a while.
Discovering new medical cures and technology is a profitable business, and thank goodness it is. Those profits drive innovation. Take away the profits, and you will surely take away the innovation.
Oh yeah, when I went to college and I started getting my degree in fucking amoebas, I was like, one day I'm gonna make a lot of money off of this.
Single payer, free healthcare, Medicare for all, they might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good.
Visions of utopia? Nah, it's just a vision of a better world, man. Ultimately produce more harm than good. Are you looking in a mirror? I'm a little scared of what I see right now. So any policy that improves the lives of poor people is a vision of utopia. It's pretty much what it is.
They might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good.
Name one country that has adopted a single-payer healthcare system and has since reverted the adoption of a single-payer healthcare system. None! Not a single country has done that. I wonder why. It would kind of suggest that it's been a policy that actually works. And just saying, ooh, these single-payer healthcare is more harm than good is kind of fucking bullshit. And you've got nothing to back it up. That's why you had to really reach for some of these arguments. All right.
I'm Lan-Hee Chen, fellow at the Hoover Institution at Stanford for Prager University.
Yeah, I know.
Thank you for watching this video. To help keep PragerU videos free, please consider making a tax-deductible donation.
But who will pay for it if the video is free? That's what I thought, Mr. Conservative. All right, we're done recording. Fuck. I don't really have anything else to say. If you want to read over any of the material cited, I guess you can do that. I guess I'll link it below, maybe. I mean, we could spend an hour going over it, but let's be real. I don't want to do that. Special thanks to the April patrons. Dios, Ian Diaby, Elsie Hupp, George, Irene Schaefer, James Paul, Joy Palamo, Laura Day, Mellow Cheddar, Suzanne Hendrickson, and Xylopa Bandcamp. I know they just say that, oh, they have these concerns about Medicare for All and the economic impact of it. But I really don't think they do, because they support all these other things that are like just wasteful. And if they really care about the economic impact, like Medicare for All is probably going to be a really good thing, because by implementing a system like that, we are in effect detaching health insurance from the workplace that we have in America, because like that they're intertwined. And that would be a really good thing to help start up businesses. That would be a really good thing to help companies pay their employees more. Be a really good thing for employee retention and lowering turnover rates. They don't seem to care about that. They never factor that into the equation. And, well, you know, all of this kind of makes sense if you just think of the Republican Party as a pro-death party. That's what they are. They don't like Medicare for All. They love the coronavirus. They love fucking spreading it. Yeah, I'm fine with saying that. They're pro-death. Bye.